My name is Timmonica, and I started coming to Balanced Living because I was having some low back issues, and I had had them since 2006 after an injury, and I had tried everything I think possible besides having surgery. I wasn't open to that, and the pain would get a little bit better, but it just wouldn't get better so that I could be more active. And so it was affecting my work. It was affecting training for Pilates. I knew I needed to be able to do that, and I just couldn't move. And if I did, then I was in bed for a couple of days and needed to make a change. I needed some help with that.
Can you explain where the pain was at?
My low back, and it was actually radiating down my right leg, and there was a lot of pain on the side of my leg, in my right hip, and my glutes. That was the most frustrating part for me. I felt like I could take the back pain. It was that pain down the leg that was really getting to me. And then waking up in the morning and just feeling like I couldn't move and just limited. And if people ask me to go do things, I'm overly anxious because I don't know how much walking it's going to involve. I don't know if I'm going to be able to carry what I need to carry. So it was affecting my social life also.
You even had to switch jobs, is that right?
I did. My training and background is as an occupational therapist, and that's where I was working and what I was doing prior to this injury and the pain getting worse. So I had to stop working as an occupational therapist, and I haven't worked as one since 2007.
And then can you tell people what's happened since you've come to Balanced Living Chiropractic?
So one of the biggest things that's happened is most weeks of the month, most days of the week, I can get up and go to work. And that's huge because not only did I have to stop working as an OT, I had to stop working, period, because I couldn't consecutively do anything on a day-to-day basis. So being able to get up and go to work each day as a young woman was really important to me. Feeling like I had a purpose and able to affect other people's lives was important to me. So that's one of the amazing things that's happened. I've now completed the classroom portion of my Pilates teaching instruction, and it's a lot of work on your body to have to do those exercises, and I wouldn't have been able to do them before coming here.
That's great. Can you tell people how this treatment's different than other stuff that you've tried?
Well, I've tried going to other chiropractors before, and I wasn't comfortable with how they would adjust me and not really take a good look at what's going on beforehand with imaging. And I also my pain was so acute at times and flared up that it couldn't handle the aggressive physical adjustments that I was experiencing. I tried physical therapy many times, the injections, the cortisone injections in my back. This was different because there's a gentle approach, it's precise, and it really, I remember when Dr. Cicala said to me, has anyone ever looked at your upper cervical? And I said no. I was very emotional about that because it actually made me think that I've lost all of these years, and perhaps if someone had looked at that area of my body and addressed it back in 2006, 2007, I wouldn't have lost those years, and perhaps it could have been still working in my field.
Yeah. So what we've done here is we had lower back pain with sciatica type symptoms, and we mainly started just working on your neck, and that's made a huge difference in how you're feeling.
It's made a tremendous difference. The pain that was radiating down my leg, I barely experience it, if at all. It's usually if I do something that I'm not supposed to do and I know better. But I was having that pain every day, all day, and very rarely do I ever experience that pain now.
That's amazing. Any last words to anyone that would be kind of skeptical about having this type of a treatment?
Well, you know, I think people get really cautious when you start talking about working on the cervical part of your neck. We have fears associated with that, and my recommendation is to give it a try. You have nothing to lose. You don't have to live in pain. and suffer, what could you lose by trying someone doing something different?
Great. Thank you for sharing your story.
Thank you.